Okotoks.
The #1 reason Albertans visit an optometrist is for dry eyes. Dry eye disease affects about 30% of the population, roughly 1 out of every 3 people. Health specialist Leah Sarich now with what eye disease looks like and, of course, how to treat it.
Yes, so first of all, we need to define it. So what exactly is dry eye? So this is when the eye cannot produce the right quality or the right quantity of tears.
Okay.
So it's chronic and it's progressive. It affects women more than men because as women age, they have hormonal changes that puts them more at risk. But it does affect a really broad spectrum of people. So I'll run down this list. So it can also affect those who work in windy, dry climates. Hello, Calgary.
Sure.
Also, those who work in front of a computer for long periods of time.
Oh, no.
Hello, most of us.
Hello,
exactly.
almost everyone.
Exactly.
Yeah.
And those who wear contact lenses, which is a huge population. They also affect people who take certain medications. So if you're on medications like antihistamines, certain antidepressants, some forms of birth control, that can also contribute to dry eye disease.
I see the side effects.
And it carries on. So then also people with certain diseases, those with diabetes, those with thyroid issues, lupus, rheumatoid arthritis, all of those people are more at risk for this disease. So lots of people are affected. So I spoke to an optometrist about the symptoms of it.
Symptoms can vary and include redness, itching, burning, stinging, a sandy, gritty feeling in the eye, light sensitivity, tearing when outdoors, tired, sore eyes at the end of the day, as well as blurred or fluctuating vision throughout the day. If you're experiencing any discomfort in the eyes, it's important to come in and see your optometrist. Medically necessary visits such as dry eyes are covered by Alberta Healthcare when you come in to see your optometrist.
So it's really important to treat these symptoms. And remember, dry eye disease is chronic and it's progressive. So what that means is you're always going to have it and it's only going to get worse if you leave it untreated. So left untreated, it can lead to visual impairment, which leaves you at risk of eye infection. The big one is it can really also, though, affect your quality of life.
Yeah, no kidding.
So think about it. So your eyes are sore, so you're going to spend less time on the computer or watching TV. That can affect your quality of life. It can even, you might even spend less time driving, for example. It could be really problematic to drive, for example.
Or on the sideline of your kid's sports field.
Exactly. All
right?
of these things. It can even make you feel tired when you're not necessarily tired because your eyes are tired.
Okay, so what do I do? If I go to the optometrist, what's going to happen?
So first thing, she's going to sit you down and you're going to fill out a questionnaire because she's trying to assess how these symptoms are affecting your quality of life and how severe they are. Then she's going to do some tests. So she's going to things like she's going to look at the white tissue of the eye. She's going to look at the cornea of the eye. She's going to use certain dyes to actually look at how your eye is producing certain tears and the tear what they call breakup time. So she's going to look at that. And then she's going to look at the oil glands as well. And then once she's made her diagnosis and assessed the severity of the disease, she'll outline your treatment options.
Oh, there you go. Okay, so lots of ways.
There are various treatment options, including lifestyle modifications. For example, if you spend a lot of time on the computer, we do recommend taking more frequent breaks where you're relaxing your eyes, perhaps using a humidifier, using over-the-counter treatments such as artificial tears, nutraceuticals such as omega-3s, prescription medications such as Restasis, and in more severe cases, surgery if needed.
So lots of treatment options. Look how sore that eye looks, right?
Yeah, no kidding.
So lots of treatment options to explore. And I will say this again, medically necessary visits to the optometrist, like for dry eyes, are all covered by Alberta Health.
Nice.
So if you're having a problem with your eye, there's no need to sit in urgent care and wait for 3-4 hours or go to a Emerge or even go to see your family doctor. Because your family doctor is not going to have all of these tests in her office, right? Or she's just going to send you to the optometrist. Exactly.
Yeah.
So just go see your optometrist. It will be covered, and then you're going to get the information and treatment that you need.
Speaking of information, your blog, right?
You betcha, all on my blog.
breakfasttelevision.ca. That's where you can find it. Thank you, Leah.
You're welcome.
1 out of 3 people, Andy. This is a windy, dry part of the country.
Sure is.
It's kind of